Hello guys, with the extreme extent of coronavirus, various health organizations and government agencies have urged us to maintain good hygiene. How do we ensure that? It all lies in this. Our hands are the key transmitters of infection. They carry pathogens from one place to another. Good hygiene is paramount, not only in health sectors, but everywhere you go, anywhere you are, you must maintain good hygiene. If you are a health provider, ensure that you maintain good hygiene. Ensure that you leave your lab coat at the hospital. Don't carry it home. Your scrubs, leave them at the hospital so that they can be sterilized. But the main thing that I wanted to talk about today is hand washing procedure. How do we ensure that our hands are clean and we observe or follow a good procedure when doing hand washing? These are instances. As a health provider, you should ensure that you wash your hands before doing any clean or aseptic procedure. After touching a patient, if you touch a patient's surroundings like beddings, if you have had a body fluid exposure, you should ensure that you wash your hands. Wash your hands after visiting the toilet, before beginning any procedure, after any procedure, and ensure you also use your PPE, personal protective equipment, very well. Like I would recommend you to use a double gloving technique where you have to wear double gloves. Don't, and I repeat, don't forget to wash your hands when you are leaving the hospital environment. Back to our main business, hand washing procedure. How do we do it? Follow along. Come with me. Mostly we use two common antiseptics. That's alcohol-based antiseptic and soap, which is the most common. The advantages of using alcohol-based antiseptic is that they are more tolerable to the skin, they're effective and faster to clean your hands. And the disadvantage is that it cannot be used when the hands are highly contaminated, and it's not effective in eradicating spore-forming organisms, for example, Clostridium difficile. First of all, we will begin by soap. And before beginning this procedure, ensure that your nails are short, like mine. Remove hand accessories, like watch or bangles if you have them. Remember this, if your hands are highly contaminated, or if you have come in contact with body fluids from the patient, or you are from the toilet, use soap to wash your hands. Soap is an effective antiseptic. Not that I'm trying to promote soap over other antiseptics, but research has proven that soap is an effective antiseptic. This procedure is supposed to last somewhere between 1 minute. Let's begin. You should ensure that you are using running water. So the first step is that you wet your hands with the water. After wetting your hands with water, pick your soap. Apply enough soap to cover your hand and your hand surfaces. Then you rub hands palm to palm. Rub your hands palm to palm. Then rub your right palm over the dorsum of your left hand with fingers interlaced. Rub the back of your fingers to the opposite palm with your fingers interlocked and vice versa. Place your left hand in your clasped right arm and rotationally rub the thumb. Then repeat using your right thumb and clasp left arm. Finally, rub the clasped fingers of your right hand into the left palm and vice versa. After doing so, you have to rinse your hands in water. You have to dry your hands using a towel. Do it like this. I'll use the same towel to close my tap and ensure that I dispose it. Okay, my hands are clean. Ensure that you follow this and practice good hand hygiene. The same procedure is applied when using alcohol-based antiseptic, but because I don't have it right now, the same procedure that I did with the hand washing with the soap will also apply when using alcohol-based antiseptic. So guys, let's observe good hand hygiene and help fight infection, especially now trending and common COVID-19, also known as severe acute respiratory syndrome or Middle East respiratory syndrome.